It is the responsibility of all healthcare professionals and healthcare providers to maintain patient privacy and confidentiality and to access the health information only on a need-to-know basis. With that in mind, we're going to go through a few of the HIPAA regulations that have to do with securing an EHR. First of all computers, all electronic devices that will be accessed to look at information on an EHR needs to be password protected. You need to make sure that every time you log out of the EHR that you log off and that you are the only one that can access it with your password. If you leave the information up and someone else accesses using your password, anything that happens in that EHR will then become your responsibility. Each identifier needs to be unique. Everyone has to have their own special login and identification. And when you access protected healthcare information, it should only be on a need-to-know basis. A lot of times the information that's in there will be protected and only certain individuals can access certain areas of the electronic health record. There should be a security policy in place that addresses the backup of data, where that data is going to be stored, how it's going to be stored, and how it will be restored if there is any reason to have to get at the backup data. There is an ability to audit who has accessed this record and what was viewed, what was edited or deleted. Again, really important when you're making entries into an electronic medical record, all entries and deletions will be recorded and they are able to be audited. Using procedural terms and ICD-9 codes to store information and to transmit information, always need to use the procedural and diagnostic codes. When we need to release information, it's important that we have certain things in place so that any information that is released or shared has been approved by the patient. In order to satisfy meaningful use requirements, which is set out by the Health Information Exchange. Again, this information is going back and forth electronically, and we want to make sure that access to it is limited and protected. When we share information from the point of care with other providers, it's essential for continuation of care. It's essential for us to be able to share that information with other providers involved with this patient's care. But with that in mind, we need to make sure that everything that's transmitted is protected and there is a certain amount of confidentiality that is maintained. Providers can access findings of other providers or any test results that have been taken to look at the results immediately, and this will definitely improve the patient's care. All the sharing of the protected healthcare information must be done through a secure environment. And there is lots of information that's going to be shared back and forth, and that there need to be regulations, rules and policies at your office that take care of these regulations that are set out by the National Health Information Network Exchange. These are the people who are in place to make sure that all of the communication that goes back and forth is secure. You need to have secure email put in place, and if you are unable to secure that at your office, using the National Health Information Network Exchange is something that can be done, and they actually process all these electronic communications through this exchange and make sure that privacy is maintained. All computerized functions must be kept confidential and secure. Again, making sure that as little protected healthcare information is exposed as possible and only on a need-to-know basis. There are compliance plans in place. There are healthcare organizations that have implemented EHRs that have written compliance plans. They need to be accessible to everyone. They need to understand what these policies are and how to maintain compliance, and they have to be available to everyone. It's going to address the privacy of the information that's there, how we're going to maintain security of that information. Obviously, meaningful use is something we're going to hear over and over again when we talk about electronic health records, and there needs to be written policies about what is going to be done with this information in order to maintain meaningful use. And then general health information regulations. This should all be kept somewhere in the office in a written format or electronically, and needs to be available to all staff. When you're looking at electronics, there's always the possibility that there could be a power outage or some sort of surge, and then the information isn't available. So we need to make sure that we have a contingency plan in place so that if there is ever a system fail, we still have access to that patient's information. We can't put a patient at risk because we can't access their healthcare information. There are potential security concerns when we are addressing these things. We need to make sure that wherever these items are backed up, that they are still kept in a confidential format and that they are not accessible to everyone. There should be a written disaster recovery plan in place, and that everyone knows what that is, knows how to find it, and has step-by-step procedures on what to do in the case of a system fail. When we're looking at an electronic health record, there is so much information that's shared that isn't necessarily documented in the patient chart as medical history or other histories, and goes above and beyond insurance claim forms. There are internal communications that happen within the organization that can be conducted. So it's not just patient information, it's just a way to run your office. And this internal communication is called intranet. And there's lots of information that can be shared, but some of the examples that we have here are policies and procedures. There should be a way to access the policies and procedures of an office. There are a lot of times organizational charts, directories for the staff and the providers. The forms that you may use, publications and newsletters that may be published by your organization, can make it up onto a site that is shared within the organization. Maybe there's a calendar of events, or scheduled office meetings, and then the minutes that follow. And maybe just a basic facts question and answer section that can be on an intranet type communication. Other types of communication that may get into the patient chart could be in the form of a form that you may use to fill out information. There may be reports that once we print out, or once we find those reports, make those reports, we need to have a place to import them into our EHR. Test results for patients need to get in there. There are verifications. Once we verify information, if we take a copy of someone's health insurance card, we want to make sure that those verifications get into the electronic health record. And insurance coverage. We want to make sure, again, that this is integrated, that it's all encompassing for patients' information, so that it is, we can be the most effective at taking care of the patient and making sure that the information that we need for the patient, as well as billing, is all accessible. Most of the documents that are going to be uploaded or imported into an EHR are going to be done by scanning those documents. A lot of physician practices now are just starting to implement their electronic health records, and a lot of it starts with scanning the current documents that they have, which digitizes them and puts them in a readable format, and then those scanned documents can be imported into a patient's record. So there's a lot of labor-intensive work that goes into setting up and getting ready to go into an EHR system, and one of those is the scanning of the current documents that they have. One of the things that makes it for effective use of time are master files, and these master files can give us some sort of structure, and the structure that's set up is going to make all this documentation easier and faster. The way that we do things, so if you are going into a patient's file, instead of having to fill everything out, you could have drop-down menus. There are choices to pick. So, you get to the allergies and you can drop down and pick if there are any allergies, or you might put none known. So those are important in order to make working in the EHR faster and easier. And again, the reason we have an EHR is so that we can have better patient care. and we don't want to be spending all our time filling out files and documents and templates on the EHR and not having the adequate time that we want to spend with the patient. Templates, like master files, are going, again, to make documentation easier and faster. But these are pre-formatted, and they're built into either the practice management software or into the electronic health record, and they should be in place before you go live. Again, there's a lot of preparation that goes into getting ready to go live with an EHR. It's scanning documents, getting them into the files, getting your templates set up so that once you go live with your EHR, everything is in place to make it as effective and efficient as possible. These templates can be something that you purchase from a software company and they're already set up for you, or you can get them personalized and have a lot of flexibility with them for individual users. There are lots of benefits to an EHR that have to do with patient care, and one of them is a task list. And in this task list, it is sort of the intranet that'll happen here, and the provider can go ahead and assign some projects or tasks to an individual or maybe to an entire group of folks. It might be that it's time for a subscription renewal to one of the magazines that he gets on a regular basis, and he may assign that task to someone who will do that on a regular basis. It might be that there's a seminar coming up and everyone needs to be registered. It may be that the physician, the care provider, assigns that task to someone. It might be that we need to call a patient regarding the need for a follow-up test. Again, in the EHR, the doc can go ahead into the task list, pick a task, and assign an individual to take care of it. Another benefit are flags. And this really works well when we're talking about taking better care of our patients because we have an EHR. And they can be added right into this system, and they're there as reminders. And really that's what a flag is. It's a reminder. It may be that somewhere in that patient file you make a flag that the patient is non-compliant. And that may mean that they're not taking their meds the way that they're supposed to. It may mean that they're not going for their follow-up testing. And it's important to put that in there because if a patient falls into ill health and we have not made any notes that the patient is not following the protocol, then we really have looked like we've neglected our patient. So we want to make sure that that is in there and that when that patient comes in, we have an idea that we're working with a non-compliant patient. It may be that we've worked out a relationship with a patient where we're not going to be charging them a late fee if they haven't made payments in a timely manner. It may be that we'll put our allergy flags up here. This would be a good place to say that they're allergic to penicillin or they have some other allergies. And then clinical alerts, which are great as we start to take better care of our patients. We can have flags in there. You know, when a patient gets to a certain age, we want to set them up for a bone density. And then we want to put in there flags that say it's time for the patient to come in and get a pap smear. And in our calendars, these will populate and we'll be able to send out reminders to patients. We can put in there what a patient's diagnosis is sometimes too. So these are all important for us as we move into taking better care of our patients. The Center for Medicare and Medicaid Services has said that there are certain core and menu objectives that you're going to have in place if you want to be eligible for those monetary grants that we talked about earlier. If a practice is going to implement an EHR, which can be very costly, and are looking to receive some grants from the CMS, there are certain things that they absolutely have to have in place. And the first list are core objectives. And I've only listed a few here, but the 15 core objectives are listed in your text, and they're also listed out on HITECH's site. One of them is that we need to make sure that we're using computerized physician order entry. All that we're doing needs to be computerized. We can't be doing things manually anymore. There needs to be a list in a patient's chart that notifies if there's any drug interactions or allergies. We need to show that we're checking for those things. We need to be using the e-scriptions, e-prescribing on a regular basis. We need to make sure that we are recording a patient demographic information completely All of those demographic information points that we talked about earlier need to be recorded. Recording of vital signs when we're filling out the SOAP notes. Part of our objective findings are going to be these vital signs. Clinical decision support functionality. We need to have documentation that our clinical decisions, that the patient's support is coming from what the physician is finding, and that he's making decisions based on the information found in the EHR. And again, privacy and security provisions. There are 15 core objectives, and all 15 have to be met in order to be eligible for these monetary grants. The menu objectives are also in place, and they're ones that are going to, again, increase the usability, the effectiveness of the EHR, and there are 10 of them. And in order to receive monetary grants, we need to make sure that we're at least implementing 5 of those 10. And some are listed here with the drug formulary checks. That means that we're looking at the drug formularies, and if there's a generic drug that is just as effective as a name brand, that we're looking at that and we're e-prescribing generic drugs whenever possible. We need to be sure that the lab test results are documented in the EHR, that we're not just ordering them, but once the lab results come back, we're documenting them and getting them into the EHR. Patient reminders are being generated. It's time to come for your annual physical. It's time to come in for your pap smear. It's time to schedule a colonoscopy. So those patient reminders need to be generated from your EHR. Patient education. When we talk about non-compliant patients, a lot of times it's because they just don't quite understand what it is that's required or what they're expected to do. So patient education is important. If you have patients who are diabetics, you have patients who are dealing with high blood pressure or high cholesterol, what have we got for patient education to give to these patients when they're in our office and when they're leaving our offices? And then immunization registries, keeping track of folks' immunizations and making sure that we get this listed on registries. And we'll talk a little bit about registries. Clinical decision support is a process that's going to help healthcare providers, again, make clinical decisions that are going to enhance a patient care. And again, we're going to talk about these reminders and alerts, any diagnostic or therapeutic guidance, leaning them in a direction to get the right diagnostic or therapeutic testing done. And in this clinical decision support, there's software that actually links them to experts at the CDC, the Center for Disease Control, and the Mayo Clinic. And what happens, because we have these links to these experts, we are able now to benefit from the best practices of folks who have found good results in certain diagnostic tests or therapeutic treatments. There are lots of reports that can be generated from an EHR, anything from payment analysis to appointment analysis, who are the referring providers, keeping a report of patient balances, and then looking at what procedure codes we're using on a regular basis. So again, these reports, depending on the practice and what's going to best benefit your practice, the ability to print up some of these reports is going to be very beneficial. And then you can customize them if you need to. So it may be that you have certain managed care agencies that want you to answer certain questions for them, and you'll be able to create a report that can answer those questions. Federal, state health departments are looking for information. Certain patients come in with certain diagnoses. Some of those definitely have to be reported to your federal or state health departments. And again, public health agencies, there are certain diagnoses that have to be reported to these agencies. There's an index that's available, and in this index it's going to list places that you can find basic information. There's a disease index that's going to sort out your diagnosis codes. So it kind of gives you an idea of the type of patients that are being seen in a facility. So again, if you're living in a very busy urban area, you may be seeing more patients with a certain diagnostic code, with certain diagnoses, than in maybe a very rural area. So again, the facility is able to now sort out who their patients are, what types of patients are being seen. There's a physician's index that's available, and this is going to be a list of who the patients are seeing in this facility. And again, it's really important if you've got a multi-provider facility to have a look at how many patients each provider is seeing. And then a procedure index. So again, we have a diagnosis index and we also have a procedure index. What procedures are being performed on a regular basis, either at this facility or by certain providers. And this is all really important when you're looking at the business of healthcare. So this is definitely going to help a practice to be financially sound. We mentioned a little earlier about registries. And what a registry is a listing of whatever information you're looking for in chronological or date order. And there are admission and discharge registries at a hospital. The list of admissions on a daily basis and who's being discharged on a regular basis, and it's listed in a registry. Birth registries are kept by cities. Death registries are kept by cities. Cancer registries, where every case of cancer is reported, and this is actually required by law, that if you have a patient who has cancer, that has to be reported to the cancer registry. Trauma registry, what kind of traumas are happening, whether they be broken bones or whether they be electrocutions or any type of trauma that happens, gunshot wounds, stabbings, those types of things are listed in registries. And then we mentioned earlier immunization registries. The CMS is going to receive this registry information directly from your EHR, which means you don't have to produce a separate piece of information, because as you're reporting these in your EHR, the CMS has access to that, and that's going to take care of the PQRI measures, which is quality healthcare, and that we are tracking our patients, and we're tracking the types of diseases and births and deaths and all of that, and immunizations that are happening in our practice. Health information management really is about ensuring that the very best information is available to all the healthcare providers, and so that when it comes to making any healthcare decisions, we've got the best quality that we can have. And there are lots of people, when you talk about healthcare, who'd be considered stakeholders. Who is this going to affect? Our patient care organizations, in other words, hospitals and physician practices, those are patient care organizations, and they're definitely going to be served by this health information management of this, all this information that we're putting into the EHR. Payers, those are the insurance companies or any third parties that are going to be paying for the health care of a patient. Research and policy agencies. There's lots of agencies out there now overseeing healthcare, overseeing privacy and security, and they're all going to benefit and be served by the management of all this information. And any other healthcare related industries, and there's lots of them out there, public, state and federal agencies that we're going to benefit from good management of healthcare information.